So today's video is going to be all things staph infections. If you were lucky enough to experience our last video, we just made one recently on ringworm. Click up here if you want to go to the link. I actually don't know whether that link's going to be there or not, but I see a lot of other people saying that, so hopefully there's something there. Yeah, today we're going to talk about staph and the bacteria that causes it. We're going to go into some things you can look at as far as symptoms are concerned. We're going to go into treatment, and we're going to look at it mainly from the focus of Jiu-Jitsu. So the idea being, you're in a training room, you are not sure if you've got staph, you're not sure how to treat it if you do have staph. So we're going to cover all that today. My name's Luke. I'm a black belt in Jiu-Jitsu. I've been training for 20 years and I've been through plenty of staph infections myself. I've been around other athletes with staph infections, and hopefully we'll get a bit of knowledge out today. All right, so what is staph? I'm going to try the scientific word, Staphylococcus. So what that is, it's a bacteria, and that's what causes what we call a staph infection, and that is what leads us to becoming unwell and having big blisters and bleeding sores and all this horrible crap. So that's what it is. What are we going to do about it? So it shows up on the skin mainly in a boil. That's how we see it present most of the time. And I'm going to include photos and video all around me here, so hopefully you guys can get a good read on what it looks like. Now, when it first presents itself, it might not look like anything. It might look like a bite, it might look like a little scratch, it might look like a tiny little pimple, like a little pus-filled tiny little pimple. That's normally how I find I look, and yeah, I might scratch something on my leg or my arm and I think, oh, that's a bit odd. And then a couple of days later it starts to progress into something larger and more red, and then a couple of days later it starts to get very sore and inflamed, and then before you know it, you've got a full-blown staph infection, and you're like, well, what do I do about it? All right, so how does this thing work? Well, it's a little bit of black magic, this whole staph thing, but here's the basics of it. The bacteria sits on our skin, whether it's on your skin or in your nose. Basically, probably everybody is carrying staph on themselves at some stage, if not at all times. The thing is, does your immune system dip? Maybe you're unwell, maybe you're run down, lacking sleep, overtraining, all this type of stuff. Does that happen? And then what tends to pair up with that is a break in the skin. So whether it was a scratch from training, I mean, you think about how easy it is to catch a fingernail or any type of abrasion on the skin, matte burn, anything like that. Then those two things combined, gets in under the skin and then starts to form into a boil, and then you're going down the path of, okay, I've got an active staph infection now. So can I pass on staph to somebody else? Yes, the answer is definitely yes. It's contagious. You can pass, if you've got an active staph infection and you get, especially if you get some of the pus and the grossness from inside the wound onto another individual, and then it manages to get into a break in their skin, then the system reboots. A small story about myself. I've had staph numerous times, but one particular time I remember, I was traveling in Texas. I was at Austin and I was training with John Danaher and the team, and Nicholas Merigali, who's one of the top athletes in the world. Nicholas and I trained together and we're drilling and everything was great, getting good training in. And then the next day I noticed he was missing. And then he came in the day after and I was like, oh, where were you yesterday? And he said, I found staph on my leg. And I was like, that's great. I wonder if I'll catch it. And within a couple of days, you guessed it, I ended up with staph, and gave me a massive infection and was a real pain. So do I think no matter what I was going to get that? Well, I think I was pretty run down. I was overtrained. I was traveling. I wasn't sleeping right. I think if I had all my ducks in a row and I was healthy and rested, I probably wouldn't have even caught it off him. But if you're a bit run down, if there's a break in your skin, which obviously I had, and then you mix that with touching somebody who's got an active infection, that is a good way you can catch it. So you can catch it skin to skin. You can also catch it off surfaces. That's just less likely. It's not as common, but definitely staph can survive on surfaces. It can survive on towels. It can survive in bed linen. So we're definitely trying to not share things like that. Sharing bed linen with your training partner is probably a bit sus anyway. But things like towels, definitely, you might just chuck the guy the towel and say, go for it. That's a good way you could also pass things along. So keep in mind, staph can survive on objects up to long periods of time, up to like 6 months. So staph can be a real bastard. It can survive extreme temperatures. It can survive being put in the dryer. It can survive even stomach acid. So staph can get inside your body as well, obviously, if it's dealing with stomach acid. On a side note that's kind of interesting, some variations of food poisoning are caused by the staph bacteria getting on food being prepped incorrectly. That's not what we're talking about today, but it's a very common infection that gives people a lot of problems. But just keep in mind, it's actually not that easy to kill. So if you're going to kill it on your actual, let's say your towel or on clothing and training gear, you need to be using very high heat. You also need to be using bleach where you can. Okay, so bleach will wreck some clothing, so just keep that in mind. But if you can bleach it, bleach does a pretty good job of killing it. And that's why bleaching bathrooms is a good idea for cleaning areas that you could have germs hanging around. So obviously we're doing jiu-jitsu, we're on top of each other, we're sweaty, we're gross, we've got little cuts on the skin. Easy enough to find yourself where at some stage you get a staph infection. Like I said, normally it's going to be when you're run down or immune compromised. If that's the case, just be aware and be careful and keep an eye out for things like that. Maybe if you feel you're a bit overtrained, you might pull training back and just be aware of any spots on your body if they're starting to form up. Like the ringworm video we made, ringworm tends to get you when your immune system's low. So some of you watching along at home might start to realize that keeping your immune system high is actually probably not a bad idea. Right, so symptoms, what are we looking at? So like I mentioned earlier, it'll start normally as a tiny little pimple. Normally people say to me, oh, I just thought it was a pimple, and then it becomes something from there. So if you've got a weird pimple, keep an eye on it. Sometimes I'll even get the athletes coming up to me in the gym and just saying, look, do you think this is something? They show me a weird pimple, and I make a bit of a judgment as to whether I think it's worth them sitting out or whether it's nothing to worry about. Maybe it's just an ingrown hair. But it's very tricky to actually judge very early on if it's going to be staph. Normally it's not until it sort of forms that you'll actually even get a doctor know what they're looking at anyway. Just keep in mind, I'm not a doctor, obviously, even though I do look like a doctor. I'm actually not. Keep in mind that a lot of doctors have nearly no experience with this stuff. They have no idea. I get some people come in and their doctors are calling ringworm staph, like that was one of them, which is crazy, and giving people antibiotics for ringworm, which is not a bacterial infection, which is what you treat. Antibiotics treat bacterial infections. You don't treat fungal infections with antibiotics, but hey, I'm not a doctor. But be careful. Your doctor may have no idea what they're looking at. If your coach is experienced or other athletes are experienced, have a chat with them. But you're going to be seeing things like a red mark. It'll start to raise and become a boil once it gets to an infected point. There'll be oozing pus. It can be quite warm to touch. You might even feel like if you've left it too long unattended, it can even lead to giving you fevers. Now, if it's getting to that stage, you need to be very careful because it's starting to get into your bloodstream. So you need to take it seriously. It is a serious infection, but we can deal with it. So as far as prevention is concerned, I feel like it's difficult. Obviously, all the normal hygiene is going to be great. So anytime you can be clean with your hands, this is a great idea. Meaning washing your hands with soap regularly before you eat, before and after training. All these things are a great idea. If you go to the bathroom during training, wash your hands, make sure you wear your shoes in the bathroom. These are all basic principles, but all these do add up to something. So you'd be surprised the amount of stuff you can limit from happening if you can do that. Now, that's not to say if you've got a staph infection in your nose, or I should say staph in your nose or on your skin, which I've already said most of us do most of the time. What's mainly going to happen is you could do everything you wanted prevention-wise, but there's going to be a time you run down. Maybe you don't even realize that. You didn't sleep well the last few weeks, or you've been sick with something else, and then next thing you know, it whacks you. So just be aware is the main thing. We can always do a good job with hygiene, but there's going to be a time where it starts to hit you no matter what, and then it flares up. So treatment, as far as treatment's concerned, here's my protocol nowadays. What I do is I see a bit of a weird looking pimple and I'm like, I'll keep an eye on that thing. The weird looking pimple, I wake up the next day, it's now a red sore mark. And I'm thinking to myself, okay, is it just an ingrown hair in there? Is it maybe nothing? What I don't do is I don't rush immediately to the doctor and start antibiotics, because the problem with taking courses of antibiotics too often is that they have a lot of other negative side effects. Now, I'm not saying don't take antibiotics. What I'm saying is be careful, because nowadays everybody's taking antibiotics for anything they can get their hands on. You know, they have a cough, they're taking antibiotics. The kids are sick, they're taking antibiotics. They've got a bump on their skin, they're taking antibiotics. And before you know it, you're just smashing your microbiome, and you end up with all these other problems down the track with your body, sometimes that are worse than whatever it is you were trying to treat. So I'm not saying don't treat it with antibiotics. I'm just saying be careful. Don't just immediately reach for the Staphylex 500 and start popping pills. All right, have a think about it, have a look at the infection, see how it's progressing. Now, what my protocol is, if it gets to the point where I'm starting to look and go, this thing has formed a lot of pus, this is looking down the direction, it's a big red boil, it's looking like what I now know as a staph infection, then I start to think to myself, okay, you know, it's going to take a period of time to treat this thing, anywhere from, 5 to 15 days. You know, it can take a period of time to get this completely, and it might even be longer till the point where you actually find your skin has gone back to normal and there's just a scar there now. So what tends to happen is you get that red blister, then it will burst open, or you can burst it open. I'll talk about that in a moment. Then there'll be a bunch of pus that keeps forming. It's like a little volcano nearly, and it will form nearly like a green pus. It's gross. The pus will continue to come out of this thing, and it will form a little cover over the top of it. Now, what can happen is the body tries to heal it up and cover over the top, and you've still got the infection inside. And that's where I see people ending up on multiple courses of antibiotics because they can't clear it out of their body. Okay, so that's something we're going to talk about. So this thing runs its course, and then eventually the infection will slowly go from being quite wide to coming back in, and then will fall back down and become flat. And that could take a long period of time. So what my protocol is once I recognize what it is, I try to get the pus out as soon as possible and continue to get it out. So when you do this, make sure your hands are clean, wear gloves if you can. Try not to spread it around your house or on other people. But I break open the top of it, and I get as much of the pus out as possible. And it's very painful. It'll be a sore infection. It'll be red. It's infected, but your job is to push. You may maybe even use cotton tips, and you can push and clear out and clear. It's absolutely gross. Get as much of that white, gooey, green crap out of the middle of it as possible until basically it's just bleeding, and then let it sit and cover it. What I like to put on it is antibacterial cream. So you can buy Neosporin. You can buy, in Australia, there's some other stuff you can get. There's a few different ones you can get. There's one called Corsig that's pretty good. And what Corsig is you don't actually, because in Australia we don't sell, or the Australian government don't allow antibiotic or antibacterial cream to be sold over the counter. But you can go and over the counter get this Corsig, which is an eye drop. It's made for conjunctivitis in your eye, but you can treat bacterial infections with it. So there's a little bit of a hack if you can get the Corsig, Corsig, I think it's called. Don't hold me to that, but I'm pretty sure that's correct. Each time I go to America, I just get myself a few tubes of Neosporin and the antibacterial antibiotic cream, and I keep that on hand. And you can treat the wound with that. Now, topical antibiotics obviously is not as good as oral antibiotics, but they don't fry your microbiome the same way that the orals do. So what I will say is, if you can get away with treating it without oral antibiotics, that is good. But you might find, let's say you had 10 staph infections, you might find 7 of them you have to have antibiotics for. So just keep that in mind. I'm not saying don't use antibiotics. There's a time and a place, and if you need it and it's making you unwell, you've got to treat it. But sometimes, and I've definitely treated, I had a couple of reoccurring infections, and I got to a point where it was like, I just don't want to take any more antibiotics. And I did manage to clear one from beginning to end with no use of oral antibiotics, just topical. So it can be done, but be careful. You know, if this thing gets out to a point where it's real bad, it can make you very sick, and you don't want to end up in hospital or dying. That'd be bad. But it will also take longer. It will take much longer. I remember talking with Isaac Michelle recently about an infection, a staph infection, and he treated it with just topicals, and it took him a substantially longer amount of time than if he'd had oral antibiotics, but it did mean that he was not blasting the rest of his body. So it's up to you on that balance there. So what I continue to do is I continue to get out the pus. So what'll happen is then there'll be a formation on top of the open wound where it starts to crust over nearly. But if you see that there's still infection inside, it sucks, but you've got to break the top of it open and push all that back out again. This absolutely sucks. It absolutely does. But if you leave it all in there and it forms a crust and skin over the top, you're going to find you're going to end up on multiple courses of antibiotics because your body's trying to fix it from the inside, and it's tough rather than letting it open up and get out of there. So this is just from my experience. Get the pus out of it. It's very important. Another thing you can do if it's quite a large wound is you can pack the inside of it with clean gauze. And what the gauze does is it stops it just continuing to fill back up with pus. That's an option as well. Depends how big the hole is. Sometimes if it's too small, you can't pack gauze in it. That would be for much larger staph infections. And if you've got a large infection, there's some horrible, I'm going to include a picture up here above me of a MMA fighter who was training over in Thailand last year, I want to say, and he got a very bad staph infection on his foot and ankle, and he was lucky not to lose his lower leg. It turned really bad. So be very careful. If it gets to the point where this thing's getting serious, you may also have to shift from treating it yourself to going into the hospital even if it gets too bad. But the goal is going to be to continue to treat this wound, covering it, opening it to clean it, covering it, open to clean it, until you get to the point where it starts to clear all of the infection out. Once that's happened, then you're just going to leave it covered until it forms over the top, and then you can start to let it heal itself back up like any normal wound. Now, it probably goes without saying, but you cannot train while you have an active staph infection. I don't care how much you're into training. I don't care how much you like it. I don't care how important that next BJJ competition is for you. If you've got an active staph infection, unless your training partners are more than happy to run the risk of training with you, it's your job to stay away from the mats. You still might come in and watch training, but you just need to be very careful, making sure that you've got obviously everything covered up. You don't want to come into the gym, sit down on the mats or sit down on the seats or something and transfer something onto there and then keep going. So just make sure that if you do have an active infection, that you've got your hygiene at an all-time high, keeping your hands clean, keeping the wound covered. You can still keep yourself in the game by watching instructionals or coming into the gym and being around everyone, but no contact. There's definitely no training, unfortunately, until you clear it out. So that's a bit of a rundown on staph infections. I know it's pretty gross. I know it sucks. Hopefully all the photos that I'm going to be popping up around me are going to give you a bit of an idea on what to look for. It's something that a little bit of knowledge goes a long way. So hopefully this helps you out. And if you've got any questions, put them in the comment section. I'll answer them if I can. And if you want to see more videos like this, let us know, and see you on the next one.